Thank you very much, viewers, for having the opportunity to view this video. I wish to welcome you to Savannah Healthcare Services Limited. And we're really concerned about your welfare. We're really concerned about your wellness in all aspects. And as you realize, this is a month for breast cancer. And we want to tell you a little bit about breast cancer so that you're all aware and therefore you get some opportunity to go and have checkups for breast cancer. As you are aware, the position of the breast is a very prominent organ in our ladies' chest, and a very sentimental part of the ladies' bodies, and that is why we want to make sure that we do checkups and ensure that we tell you about breast cancer. Breast cancer is now quite a leading cause of cancers. We know that cancer of the cervix has overtaken the breast, but breast is still a number 2 killer in women. And as you know, the trend for cancers has changed. We used to get breast cancers in the 50s, but we are now seeing, even in early 20s, some young ladies getting breast cancer, even in the 30s. Now other dynamics have come. Other conditions like HIV, diabetes are contributing to early emerging of breast cancer. And that is why it is extremely important to have breasts checked for cancer. Also to mention that breast cancer is associated with diseases like diabetes. It is also associated with the diseases like hypertension. So hypertension is not just a hypertension on its own. It is also, can also be related with breast cancer, cancer of the uterus, cancer of the thyroid, and cancer of the ovary. So they run as one kind of a cohort of diseases. And that makes it very important because you have seen rise in diseases like diabetes and hypertension, and they can predispose to formation or emergence of breast cancer. So what causes breast cancer? We do not know, as usual in most of the cancers, except cancer of the cervix, which we all know that is now a sort of a sexually transmitted cancer. But for breast cancer, we do not know what really causes it. It has risk factors. Among them, age. Of course, it's more in women, but remember, also men can get breast cancer. It's also associated with other conditions like smoking. It's also associated with other bodily issues like high BMIs, that is obesity, and other diseases like diabetes and hypertension, just like I have mentioned earlier. The other chemicals that are associated, for example, chemical and other elements that are associated, exposure to radiation, X-rays, also exposure to other cancer treatments can also predispose to breast cancer. If there is a family history of breast cancer, then that is more than doubles the possibility of someone getting breast cancer. And how does breast cancer present? As all cancers, it always shows when it's a bit late. But the usual presentation will be a lump in the breast, initially a very innocent lump that can be anywhere in the breast. It suffices to mention that there's a difference between cancer of the breast lump and what is commonly found in ladies called fibroadenoma. A fibroadenoma mass or lump in the breast is normally a smooth lump that moves all over the breast, but a cancerous breast lump will always be fixed. Again, on top of on the skin of the lump, for fibroadenoma, it is normally in the normal skin. But for the cancer of the breast, it is always like an orange, or we call it the orange. It's like an orange, the skin of an orange. It can be inverted. It can also have lots of blood vessels and they can change color into darkish. So that always will signal an alarm for possible cancer of the breast. Sometimes we can have such lumps in the axilla, in the armpit. And therefore, that's why the reason being during examination, that's why you always check the armpit, because the armpit is part of the breast. In as much as the breast is on the front part of the chest, then there is also what is called a tail of the breast that goes right into the armpit. And it's really important to mention that those are lymph nodes, and sometimes even the breast mass can go into the armpit, so you can get that. Other signs can be blood vessels, very prominent blood vessels on the breast. Others can be a discharge on the breast, and most of the time the discharge on the breasts will be bloody. Other times you see the breasts, the involved breast is larger than the other normal breasts. And you can also see that sometimes if a lady lifts their arm, if you expose their chest and you tell them to lift their arm, you'll find that the breast that has cancer will not move with raising the arm. So you raise the arm, you see the normal breast will move up with the arms, but the one with the cancer will remain behind. That is another characteristic sign of breast cancer. So breast cancer is also in stages. It can also be in one place near the nipple. It can go to other areas of the breast. It can go to the chest wall, and finally can spread into the lungs and other areas. Now that is stage 4. As soon as such a suspicious lump is gotten, through some tests that are normally done, mammogram, breast ultrasound, then you can also do a biopsy to determine if that is breast cancer. This is why it is important, and that's why we say every 2 years, all ladies above 30 years can do a mammogram to ensure, and especially we even tell the ladies with the history, a very, very suspicious history of breast cancer. For example, if someone's mom has had breast cancer, a sister or an auntie, that is very important to remember that they must do that. As I mentioned earlier, if one has unfortunately a bit obese, they are diabetic, they are hypertension, they should never miss screening for breast cancer. Normally it starts very simple. If you go to the doctor, they'll teach you what is called BSE, breast self-examination. So they show you how to examine the breast. And the breast is normally examined in quadrants. So you divide the breast into 4, so you have 4 quadrants, and then you have the central area where the nipple is, and then you have another final area that goes into the armpit. That is very important. So you'll be shown the systematic way, and we are doing that in Savannah in this month, where we will teach all our ladies breast self-examination. Then after that, if there is a suspicious lump, if it's age below 30 years, then they can do a breast ultrasound. If it's above 30 years, then they can do a mammogram. So it suffices to say, as part of the checkups, it is important every 2 to 3 years for a lady 30 years and above to do a mammogram. And there's also what we call cancer marker, CEA, and other cancer markers, very, very important, that can raise the alarm in breast cancer and help to save a life. Because what we are saying in breast cancer is, if you get the breast cancer in stage 1, surgery and even sometimes total excision will save someone's life. As opposed to when you get it in stage 2 and above, when it has spread to other areas, then surgery will be combined with chemotherapy, with radiotherapy, and sometimes the treatment is not 100%. Yeah, we can say that the treatment is looked at in terms of prognosis. And when you're talking about stage 4, the 5-year survival rate is very, very low. In fact, it is less than 50%. Yeah. Whereas in stage 1, you're talking of survival rate more than 90%. So you can see it helps to discover the breast cancer early. Sometimes when they come late, someone might present with a cough because it has already gone to the chest. Difficulty in breathing, wasting, those are now the bad signs of cancer of the cervix. Sometimes it can go to other areas, including the brain, and it can also go into the bones. This is when you're talking of a cancer that is really spread, and chances of survival in such cases are very poor. The prognosis, the chance of survival is normally quite low. So it is important, dear ladies, and also the men, to accompany the ladies in this year's October Breast Cancer Awareness Month, where in Savannah we shall teach you to do breast self-examination and be able to guide you on the tests that you can do, both the tumor markers and also radiological, including ultrasound and mammogram. Thank you.